I'm Jeffrey Peck. I'm a board certified surgeon here at Veterinary Care and Specialty Group, which basically means after veterinary school I've done internship and residency training and passed the certifying examination for the American College of Veterinary Surgeons. At VCSG, I do mostly orthopedic surgery. I do soft tissue surgery as well, but my main focus is orthopedic surgery with a particular focus on total joint replacement surgery. I have been doing total hip replacement surgery for the last 25 years or so. I'm a founding fellow in joint replacement under the American College of Veterinary Surgeons. That's a fellowship that is housed under the umbrella of the American College of Veterinary Surgeons. At this point, there's probably 13 or 14 fellows in joint replacement surgery in the country, actually in the world. We're one of the only joint replacement facilities really in the southeast United States. So pretty much for a 200 to 300 mile radius, we're the only one, or one of the only ones, and certainly the highest number of experience in total joint replacement in this region by far. It is a procedure that most people have the perception that it is a high-risk procedure. That perception is probably based on surgery 30 years or more ago. Implants have come so far in the last 25 years that it is a very repeatable, low-risk procedure. There's probably about a 3.5% failure rate with total hip replacement in our practice. That's when you combine short and long-term outcomes. And function-wise, my expectation is a dog that receives a total hip replacement is going to function as if it had a normal hip. Most dogs, the reason we do total hip replacement is due to hip dysplasia. There's other reasons, fractures involving the hip or the femoral head, which is the ball of the ball and socket joint. Those are other reasons we would do total joint replacement or total hip replacement surgery. And we can do them on dogs as young as 5 or 6 months of age, and I've done as old as 14 years of age. In the really young dogs, I typically only do the surgery if they've had a dislocation, a complete dislocation of the hip, so the ball is completely out of the socket. Otherwise, I prefer to wait, if we can, till about a year or a little bit over a year, if we can. But it's not imperative, does not significantly increase the risk. The bigger challenge, honestly, is the activity restriction after the surgery when you're doing it in a puppy. I've probably done between 1,300 and 1,400 total hip replacements in the last 23 years or so. And at this point, honestly, most of our referrals for total hip replacement come from other board certified surgeons. The reason is that very few surgical residents even get exposed to joint replacement surgery. We honestly have a resident here today from Auburn University, and she's come up to scrub in on a total hip, on 2 total hips today, because she doesn't get to see them as a resident at Auburn. It's again, unfortunately, or fortunately for me, I suppose, but unfortunately much less common for surgeons to be trained and comfortable with the procedure. So something else that we offer at VCSG that isn't offered typically, certainly at a general practice, it'd be very uncommon, but even at referral specialty practices, it often is not available, is minimally invasive surgery. Minimally invasive surgery basically involves, from my perspective, I talk more about orthopedics, where we are making a minimal approach in order to accomplish the same outcome that we historically would have to have made a large surgical approach with a lot of soft tissue dissection. And examples are arthroscopy, elbow arthroscopy, which we do a lot of for hereditary orthopedic abnormalities, shoulder arthroscopy, also for hereditary orthopedic abnormalities, but sometimes for fractures, and it allows us to see the joint surface and see what we're accomplishing at the level of the joint surface without opening up a joint and therefore potentially making it unstable or increasing the severity of arthritis long-term, or having instability that causes more discomfort post-operatively. In addition to that, we've got C-arm fluoroscopy for intraoperative use. That's basically a moving X-ray that we use during surgery, so I can see how I'm manipulating the bone or a joint without having, once again, to make a large approach with an extensive amount of soft tissue dissection. Because the more we disrupt those soft tissues, the longer the healing process.